Question 1. A nurse is assessing a 2-month-old infant during a well-child visit. Which developmental milestone should the nurse expect? A. Rolls from back to abdomen. B. Social smile. C. Walks with support. D. Says mama specifically. Correct answer, B. Social smile. Rationale. By 2 months, infants typically develop a social smile, begin cooing, and visually track objects past the midline. A social smile is one of the earliest indicators of normal social and neurological development. Why the other options are incorrect? A. Rolling from back to abdomen typically occurs around 5 to 6 months. C. Walking with support usually begins around 9 to 12 months. D. Saying mama specifically is expected around 10 to 12 months. Question 2. A nurse is evaluating the development of a 4-month-old infant. Which finding indicates normal growth and development? A. Sits without support. B. Rolls from abdomen to back. C. Walks independently. D. Uses a pincer grasp. Correct answer, B. Rolls from abdomen to back. Rationale. By 4 months, infants commonly roll from abdomen to back, have good head control, laugh aloud, and reach for toys. Why the other options are incorrect? A. Sitting without support occurs around 8 months. C. Independent walking usually occurs around 12 months. D. A pincer grasp develops around 9 to 10 months. Question 3. Which developmental milestone should a nurse expect in a 6-month-old infant? A. Pulls to stand. B. Sits with minimal support. C. Walks with assistance. D. Uses 2-word sentences. Correct answer, B. Sits with minimal support. Rationale. At 6 months, infants can usually sit with minimal support, roll in both directions, transfer objects between hands, and begin babbling. Why the other options are incorrect? A. Pulling to stand occurs around 9 months. C. Walking with assistance occurs around 10 to 12 months. D. 2-word sentences develop around 2 years. Question 4. A nurse is assessing a 9-month-old infant. Which milestone requires further evaluation if absent? A. Transfers objects from one hand to another. B. Pulls to stand. C. Uses a pincer grasp. D. Smiles responsively. Correct answer, B. Pulls to stand. Rationale. By 9 months, most infants can pull to stand, crawl, sit without support, and begin cruising. Failure to pull to stand may indicate delayed gross motor development and should be evaluated further. Why the other options are incorrect? A. Object transfer develops earlier, around 6 months. C. A pincer grasp begins developing around 9 to 10 months and may still be emerging. D. A social smile develops by 2 months. Question 5. A nurse is assessing a 12-month-old child. Which milestone is expected? A. Walks independently. B. Rides a tricycle. C. Uses scissors. D. Copies a square. Correct answer, A. Walks independently. Rationale. Most 12-month-old children can walk independently or take a few unassisted steps. They may also say 1 or 2 meaningful words and use a mature pincer grasp. Why the other options are incorrect? B. Riding a tricycle occurs around 3 years. C. Using scissors develops around 4 years. D. Copying a square is expected around 5 years. Question 6. A nurse is assessing an 18-month-old toddler. Which finding indicates normal development? A. Builds a tower of 6 blocks. B. Walks backward and runs clumsily. C. Skips on 1 foot. D. Draws a person with 6 body parts. Correct answer, B. Walks backward and runs clumsily. Rationale. An 18-month-old typically walks well, runs awkwardly, walks backward, climbs onto furniture, and begins using a spoon independently. Why the other options are incorrect? A. Building a tower of 6 blocks is expected around 2 years. C. Skipping develops around 5 years. D. Drawing a person with 6 body parts occurs around 5 years. Question 7. Which milestone is expected for a 2-year-old child? A. Speaks in 2-word phrases. B. Reads simple books. C. Copies a triangle. D. Hops on 1 foot. Correct answer, A. Speaks in 2-word phrases. Rationale. By 2 years, toddlers typically use 2-word phrases, have a vocabulary of about 50 or more words, run well, and build towers of 6 or more blocks. Why the other options are incorrect? B. Reading develops much later. C. Copying a triangle occurs around 5 years. D. Hopping on 1 foot develops around 4 years. Question 8. A nurse is assessing a 3-year-old preschooler. Which finding is expected? A. Rides a tricycle. B. Prints first name. C. Ties shoelaces. D. Reads short sentences. Correct answer, A. Rides a tricycle. Rationale. A 3-year-old typically rides a tricycle, climbs stairs using alternating feet, copies a circle, and speaks in 3-word sentences. Why the other options are incorrect? B. Printing a first name develops around 5 years. C. Tying shoelaces occurs around 5 to 6 years. D. Reading sentences develops during school age. Question 9. A nurse is assessing a 4-year-old child. Which developmental milestone is expected? A. Hops on 1 foot. B. Uses 1-word sentences. C. Walks only with assistance. D. Drinks from a bottle. Correct answer, A. Hops on 1 foot. Rationale. At 4 years, children can hop on 1 foot, catch a bounced ball, draw a person with several body parts, and tell simple stories. Why the other options are incorrect? B. 1-word speech is expected around 12 months. C. Walking with assistance is expected before 12 months. D. Bottle feeding should have been discontinued long before this age. Question 10. A nurse is assessing a 5-year-old child. Which milestone is most appropriate? A. Copies a triangle. B. Rolls from back to abdomen. C. Crawls without assistance. D. Uses a raking grasp. Correct answer, A. Copies a triangle. Rationale. By 5 years, children can copy a triangle, print some letters, count to 10 or more, skip, dress independently, and draw a person with at least 6 body parts. Why the other options are incorrect? B. Rolling occurs during infancy. C. Crawling occurs around 8 to 9 months. D. A raking grasp is seen around 6 months, before the pincer grasp develops. Question 11. A nurse is assessing a 6-month-old infant. Which finding requires immediate follow-up? A. Rolls from back to abdomen. B. Sits with support. C. Has no head control when pulled to a sitting position. D. Transfers a toy from one hand to the other. Correct answer, C. Has no head control when pulled to a sitting position. Rationale. By 6 months, an infant should have good head control. Lack of head control at this age is a significant developmental delay that requires immediate evaluation for possible neuromuscular or neurological disorders. Why the other options are incorrect? A. Rolling is expected by about 5 to 6 months. B. Sitting with support is appropriate at 6 months. D. Transferring objects between hands is expected around 6 months. Question 12. A nurse is teaching the parents of a 9-month-old infant about expected developmental milestones. Which statement by the parents indicates correct understanding? A. Our baby should be able to say 3-word sentences. B. Our baby should begin to pull to stand. C. Our baby should be riding a tricycle. D. Our baby should be able to skip. Correct answer, B. Our baby should begin to pull to stand. Rationale. At 9 months, infants typically crawl, pull to stand, cruise along furniture, use an immature pincer grasp, and respond to their names. Why the other options are incorrect? A. 3-word sentences develop around 3 years. C. Riding a tricycle occurs around 3 years. D. Skipping develops around 5 years. Question 13. A nurse is assessing a 15-month-old toddler. Which milestone is expected? A. Walks independently. B. Copies a circle. C. Uses forward sentences. D. Hops on one foot. Correct answer, A. Walks independently. Rationale. By 15 months, toddlers usually walk independently, creep upstairs, stack 2 blocks, and use several meaningful words. Why the other options are incorrect? B. Copying a circle occurs around 3 years. C. Forward sentences are expected around 4 years. D. Hopping on one foot develops around 4 years. Question 14. A nurse is assessing a 2-year-old child. Which behavior is developmentally appropriate? A. Parallel play. B. Cooperative play. C. Associative play. D. Team sports. Correct answer, A. Parallel play. Rationale. Toddlers typically engage in parallel play, where they play beside rather than directly with other children. Why the other options are incorrect? B. Cooperative play develops during the preschool years. C. Associative play is more common in older preschoolers. D. Team sports require school-age developmental skills. Question 15. A parent asks why their 18-month-old toddler frequently says no. Which response by the nurse is best? A. This behavior usually indicates poor discipline. B. Toddlers use no as part of developing independence and autonomy. C. Your child may have a speech disorder. D. This behavior is uncommon at this age. Correct answer, B. Toddlers use no as part of developing independence and autonomy. Rationale. According to Erickson's stage of autonomy versus shame and doubt, toddlers strive for independence, and saying no is a normal developmental behavior. Why the other options are incorrect? A. This behavior is developmentally appropriate. C. Saying no does not indicate a speech disorder. D. It is very common during toddlerhood. Question 16. A nurse is assessing a 3-year-old child. Which milestone would require further evaluation? A. Unable to ride a tricycle. B. Unable to jump with both feet. C. Unable to speak in short sentences. D. Unable to copy a circle. Correct answer, C. Unable to speak in short sentences. Rationale. By 3 years, children should speak in short sentences that are understandable most of the time. Failure to do so may indicate a language delay requiring further assessment. Why the other options are incorrect? A. Some children master tricycle riding slightly later. B. Jumping skills continue to improve throughout the preschool years. D. Copying a circle may still be developing. Question 17. A nurse is assessing a 4-year-old child. Which activity best supports normal fine motor development? A. Drawing pictures with crayons. B. Sleeping 16 hours daily. C. Drinking from a bottle. D. Remaining in a crib throughout the day. Correct answer, A. Drawing pictures with crayons. Rationale. Drawing, coloring, and using child-safe scissors promote fine motor coordination in preschool children. Why the other options are incorrect? B. Preschoolers typically sleep about 10 to 13 hours in a 24-hour period. C. Bottle feeding should have been discontinued. D. Preschoolers require active play and exploration. Question 18. A nurse is evaluating a 5-year-old child. Which finding is expected? A. Prints some letters of the alphabet. B. Uses a raking grasp. C. Cannot dress independently. D. Crawls instead of walking. Correct answer, A. Prints some letters of the alphabet. Rationale. By 5 years, children commonly print some letters, draw detailed pictures, skip, count, and dress themselves independently. Why the other options are incorrect? B. The raking grasp develops during infancy. C. Most 5-year-olds can dress themselves with little assistance. D. Crawling is not expected at this age. Question 19. A nurse is assessing a 12-month-old infant. Which developmental milestones are expected? Select all that apply. A. Walks with or without support. B. Uses a mature pincer grasp. C. Says one or two meaningful words. D. Writes full sentences. E. Waves bye-bye. Correct answers: A, B, C, E. Rationale. At 12 months, children typically walk with or without support. Use a mature pincer grasp. Say one or two meaningful words. Wave bye-bye. Follow simple commands. Why the other option is incorrect. D. Writing full sentences develops during the school-age years. Question 20. A nurse is assessing a 2-year-old child during a well-child visit. Which finding requires the highest priority follow-up? A. The child speaks only one or two single words. B. The child builds a tower of 6 blocks. C. The child runs without falling. D. The child climbs onto furniture independently. Correct answer: A. The child speaks only one or two single words. Rationale. By 2 years, children should have a vocabulary of at least 50 words, use 2-word phrases, and follow simple commands. Speaking only one or two words suggests a significant speech or language delay that warrants prompt evaluation. Why the other options are incorrect. B. Building a tower of 6 blocks is an expected milestone. C. Running well is appropriate for a 2-year-old. D. Climbing onto furniture independently is a normal gross motor skill at this age. Question 21. A nurse is assessing a newborn during the first hour after birth. Which reflex should the nurse expect to observe when the infant's cheek is gently stroked? A. Babinski reflex. B. Rooting reflex. C. Moro reflex. D. Stepping reflex. Correct answer: B. Rooting reflex. Rationale. The rooting reflex causes the newborn to turn the head toward the side of the stroked cheek and open the mouth in search of a nipple. This reflex promotes feeding and is normally present at birth, disappearing around 4 months of age. Why the other options are incorrect. A. Babinski is elicited by stroking the sole of the foot. C. Moro is triggered by a sudden loss of support or loud noise. D. Stepping occurs when the infant is held upright with the feet touching a flat surface. Question 22. A nurse is assessing a 3-month-old infant. Which finding requires further evaluation? A. Smiles socially. B. Coos when spoken to. C. Cannot lift the head while lying prone. D. Follows a moving object with the eyes. Correct answer: C. Cannot lift the head while lying prone. Rationale. By 3 months, infants should be able to lift their head and upper chest while lying on the abdomen. Failure to achieve this milestone may indicate delayed motor development or a neuromuscular disorder. Why the other options are incorrect. A. Social smiling is expected by 2 months. B. Cooing is appropriate for this age. D. Visual tracking is expected by 2 to 3 months. Question 23. A nurse is educating parents about play activities for a 2-year-old toddler. Which toy is most appropriate? A. Building blocks. B. Complex board games. C. Chemistry set. D. Video game console. Correct answer: A. Building blocks. Rationale. Building blocks encourage fine motor development, creativity, and problem-solving skills appropriate for toddlers. Why the other options are incorrect. B. Board games are more suitable for older children. C. Chemistry sets are unsafe and developmentally inappropriate. D. Video games do not adequately support developmental learning at this age. Question 24. A nurse is assessing a 4-year-old preschooler. Which statement by the parent indicates normal language development? A. My child speaks in complete sentences and asks many questions. B. My child only says 1 or 2 words. C. My child cannot understand simple directions. D. My child only communicates by pointing. Correct answer, A. My child speaks in complete sentences and asks many questions. Rationale. By 4 years, children speak in complete sentences, ask many why questions, tell stories, and are understood by strangers nearly all the time. Why the other options are incorrect. B. 1 or 2 word speech is expected around 12 to 24 months. C. 4-year-olds should understand complex directions. D. Pointing alone is not age-appropriate communication. Question 25. A nurse is performing a developmental assessment on a 5-year-old child. Which finding would require immediate referral for further evaluation? A. Cannot skip on 1 foot. B. Unable to state first and last name. C. Cannot copy a triangle or draw a person with at least 6 body parts. D. Prefers to play with one friend. Correct answer, C. Cannot copy a triangle or draw a person with at least 6 body parts. Rationale. By 5 years, children should be able to copy a triangle, draw a person with at least 6 body parts, print some letters, and demonstrate well-developed fine motor skills. Failure to achieve these milestones may indicate developmental, neurological, or learning delays requiring prompt evaluation. Why the other options are incorrect. A. While many 5-year-olds can skip, slight variation is common. B. Some children may still be learning to state their full name consistently, this is less concerning than significant fine motor delay. D. Having one preferred friend is a normal social behavior for a 5-year-old. NCLEX Pediatric Growth and Development High-Yield Review. Gross motor milestones. 2 months, holds head up briefly. 4 months, rolls abdomen to back. 6 months. Sits with support, rolls both ways. 9 months, pulls to stand, crawls, cruises. 12 months, walks with or without support. 15 months, walks well, creeps upstairs. 18 months, runs clumsily, walks backward. 2 years, runs well, jumps with both feet. 3 years, rides a tricycle. 4 years, hops on 1 foot. 5 years, skips and balances well. Fine motor milestones. 6 months, transfers objects hand to hand. 9 to 10 months, pincer grasp. 12 months, mature pincer grasp. 2 years, tower of 6 blocks. 3 years, copies a circle. 4 years, copies a cross. 5 years, copies a triangle and draws a person with at least 6 body parts. Language milestones. 2 months, coos. 6 months, babbles. 12 months, says mama and dada specifically, 1 to 2 meaningful words. 2 years, at least 50 words and 2-word phrases. 3 years, 3-word sentences. 4 years, complete sentences, speech understood by strangers. 5 years, tells stories, counts, names colors. Play milestones. Infant, solitary play. Toddler, parallel play. Preschool, associative and cooperative play. School age, cooperative games with rules. NCLEX memory tricks. 2 months smile. 4 months roll. 6 months sit. 9 months pull. 12 months walk. 18 months run. 2 years 2-word phrases. 3 years tricycle. 4 years hop. 5 years skip and copy triangle.